My name's Paul, I'm one of the paramedics on the air ambulance. Today I'm going to show you one of our Simbodies. Some of the jobs that we go to are quite complex, and equally the interventions that we need to do are just as complex. And the way we train and practice for those is using the Simbodies that you can see here. This one is in itself quite intricate. So what we do is, if we had to go to a stabbing or a gunshot, for example, we would then be able to, hopefully, if the patient's heart has stopped, get inside the patient's chest and restart that heart, providing some internal cardiac massage and also some filling of blood. So the mannequin itself allows us to actually make full incisions. So you'd make 2 incisions either side of the chest, around about where the nipple line is, and then you would go and you would get a scalpel, and once you've gone through the skin, you would then get some scissors and you'd cut through all the intercostal muscles and the sternum in the centre of the chest. By which point then you'll be able to open the chest up. For the purpose of this, I'm going to pull the skin back so I can show you inside the chest. So when you've made your incisions and you're actually inside the chest cavity, you'll be able to pull it open and you'll be able to see inside and see what's going on. So you can see the lungs, you can see the heart and some of the major blood vessels inside. So what we'll need to do is we need to deliver the heart by making a small incision in the pericardium and then allowing the heart to come out. We can then inspect it to make sure there's no stab marks or any holes that we need to either suture or staple. By which point, once we've done that, we can then do some internal cardiac massage, and we're virtually milking the heart. So we're just pushing the blood through the heart, mimicking what the heart would ordinarily do on a live patient. So we do that, one person will be doing that, another person will be ventilating the patient, and potentially what we might need to do is actually get inside the chest with your hand to do some aortic compression. So you'll put your hand inside the chest cavity and you'll grab the aorta at the bottom and you'll put some pressure on that. And what that does, it then helps keep all the blood where we need it, around the chest, around the head, limiting what goes down to the lower extremities. And once we've done that, we can then hopefully fill the patient with some more blood that we have on the aircraft or on the response cars, and then we can see what sort of response we get before taking the patient to hospital.